Did you know that tuberculosis, or TB, is one of the oldest diseases known to mankind, yet it still kills over 1.3 million people every year? Despite being preventable, treatable, and curable, TB remains one of the world's deadliest infectious diseases. Welcome back to Dr. AFIYIS Tube, where we break down complex medical topics into simple, easy-to-understand lessons. Today, we'll dive deep into tuberculosis, TB, a chronic infectious disease caused by the bacterium Mycobacterium tuberculosis. It mostly affects the lungs, but it can also attack the brain, bones, kidneys, and other organs, making it one of the most challenging diseases in global health. In this video, we'll cover everything you need to know about TB, including checkmark what tuberculosis really is, checkmark how it spreads and affects the body, checkmark its causes, risk factors, and stages, checkmark the warning signs and symptoms you should never ignore, checkmark and most importantly, the treatment, prevention, and WHO guidelines to stay safe. Tuberculosis, TB, is a chronic infectious disease caused primarily by the bacterium Mycobacterium tuberculosis. It most commonly affects the lungs, pulmonary TB, but can also involve other organs such as the lymph nodes, bones, kidneys, meninges, and gastrointestinal tract, extrapulmonary TB. It is transmitted mainly through airborne droplets when an infected person coughs, sneezes, speaks, or sings, allowing the bacteria to enter the respiratory tract of another person. TB develops when inhaled bacilli reach the alveoli of the lungs, where they are engulfed by macrophages but may survive and multiply. The body's immune response forms granulomas, tubercles, to contain the infection. TB can remain latent for years or progress to active disease, especially when the immune system is weakened. It is one of the leading infectious causes of morbidity and mortality worldwide, particularly in low and middle-income countries. TB is preventable, treatable, and curable with appropriate anti-tubercular therapy. Imagine a crowded minibus in Addis Ababa. It's early morning, and the windows are closed because of the cold breeze outside. Among the passengers sits Ahmed, a 29-year-old man, coughing persistently. But Ahmed doesn't know that every time he coughs, tiny invisible droplets filled with a dangerous bacterium, Mycobacterium tuberculosis, are floating in the air. And next to him sits Sarah, a healthy university student, unknowingly inhaling them. This is where our story begins. Chapter 1. The enemy arrives, causes. The cause of TB is a single culprit, Mycobacterium tuberculosis, a slow-growing, acid-fast bacterium with a waxy protective coat made of mycolic acid. This coat makes it resistant to destruction by many immune cells and antibiotics. Ahmed got infected a year ago when he worked at a crowded factory. The bacteria entered his lungs, but instead of showing immediate signs, it stayed hidden, like a secret spy, waiting for the right moment. Chapter 2. The battle inside the lungs, Pathophysiology. When Sarah inhales the droplets, the bacteria travel deep into her lungs, reaching the alveoli, the tiny air sacs where oxygen exchange happens. Here's what happens next. First, defense. Macrophages attack Sarah's immune soldiers. Alveolar macrophages rush to swallow the invaders. But TB is clever. It survives inside these macrophages by preventing them from fusing with lysosomes, the part that normally digests bacteria. Then call for reinforcements. The macrophages send distress signals, attracting T cells and other immune warriors. Together, they form a granuloma, a small fortress to trap the bacteria. At the center of this granuloma, the bacteria are contained but not killed. Latent versus active TB. In some people, the immune system wins, and the bacteria remain dormant for years, right-pointing arrow, latent TB. In others, especially when immunity drops, the bacteria break free, multiply, and cause active TB disease. Sarah's body forms granulomas, but if her immune system weakens due to stress, malnutrition, or illness, those walls could collapse, and the bacteria will spread like wildfire. Chapter 3. Who's most at risk? Risk factors. Not everyone exposed to TB gets sick. But some people, like Ahmed, are at higher risk. Risk factors include HIV, AIDS, right-pointing arrow weakens immune defense, malnutrition, right-pointing arrow common in low-income areas, diabetes mellitus, right-pointing arrow alters immune responses, close contact, right-pointing arrow living with an infected person, overcrowded places, right-pointing arrow prisons, dormitories, refugee camps, Smoking and alcohol. Right-pointing arrow damages lung defenses and healthcare workers. Right-pointing arrow. Frequent exposure to patients. Sarah's risk is moderate, but her cousin Hassan, who has HIV, would be in serious danger if exposed. Chapter 4. The Signs of War. Clinical Manifestations. Weeks later, Sarah begins to notice something unusual. Persistent cough lasting more than 2 weeks, coughing up thick mucus, sometimes streaked with blood, night sweats drenching her clothes, unexplained weight loss, the melting disease, constant fatigue and weakness, low-grade fever, especially at night. These symptoms are the classic warning bells of pulmonary TB. But TB doesn't always stay in the lungs. Chapter 5. When TB travels, stages and spread. TB has stages, and understanding them is like watching a battle unfold. Stage 1. Primary infection. Sarah's initial exposure. The bacteria settle in the lungs and form granulomas. At this stage, she might have no symptoms. Stage 2. Latent TB. Her immune system temporarily traps the bacteria. She feels healthy but carries a hidden time bomb. She's not contagious yet. Stage 3. Active TB disease. Months or years later, if her immunity drops, the bacteria reactivate and cause full-blown symptoms. Now, Sarah is highly infectious. Stage 4. Miliary TB. Disseminated. In rare cases, TB spreads through the blood to multiple organs, liver, spleen, brain, kidneys, causing life-threatening complications. Chapter 6. The Dark Side. Feared complications. If TB is not treated early, it can destroy the body silently. Ahmed, sadly, ignored his symptoms for months, and now he faces massive lung destruction. Right-pointing arrow cavitations, respiratory failure, pleural effusion. Right-pointing arrow fluid buildup around lungs, hemoptysis. Right-pointing arrow coughing up large amounts of blood, meningeal TB. Right-pointing arrow infection spreads to the brain, causing seizures and coma. Spinal TB, Pott's disease. Right-pointing arrow leads to deformity and paralysis. Disseminated, miliary TB. Right-pointing arrow affects multiple organs and can be fatal. Epilogue. Hope against TB. The good news? TB can be cured if detected early. Sarah visits a clinic, gets tested, and starts the 6-month DOTS regimen, a strict treatment using multiple antibiotics. Ahmed, after months of suffering, finally seeks treatment too. With consistent care, both recover and return to normal life. But the story doesn't end here, because TB is still out there, silently waiting for its next opportunity. Dr. Afiyas Tube is a YouTube channel which dedicated to advancing medical education that explore case-based learning in internal medicine, surgery, gynecology and obstetrics, pediatrics, psychiatry, and healthcare topics to sharpen your clinical skills. Don't forget to subscribe, like, share.